medical communication, MSLs, where we see things going in this ever-changing world of ours. And maybe as part of the initial introduction, or the initial question, you'd like to just give it a background on yourself and where you're coming at this question from. I know this is going to be fairly quick fire. I think we've got 30 minutes for this today. So I wanted to start with, as we all know, the world has changed so much in the past 20 years or so. The way we communicate has just changed dramatically. And to some degree, medical information hasn't perhaps kept up with the pace of that change. So I wanted to start with getting your views around how do we keep up with that pace? Is there a mismatch with how we're articulating medical information and everything else we see in this crazy world of communications at the moment? And Maja, perhaps I can come to you first and maybe start with a bit of introduction on yourself as well.
Yes, thanks, Paul. So my name is Maja Beilmann-Schramm, and of the 20 years in pharma that I spent 10 years in field medical as a field medical or MSL, which is mainly called, and or a manager, and now I'm in a global excellence function with Merck EMD. And everything I'm going to share, in my opinion, today is really focused around the field medical or MSL activities. And when I'm hearing that we might have a mismatch here and medical information or communication is not up to date, I wonder if it's less of a mismatch really, but it might actually be that we require more flexibility. In the end, we communicate with a person, and we try to meet the person at some level, right? And we want to match that level. So I'm not saying it's a mismatch, but I would say that we require a bit more flexibility and maybe a bit more strategy as well when we're communicating, as people and physicians are included here. A use of many different ways of communicating, be it social media, be it what have you. And we have not adapted to this. And I don't know if we need to, but at least we need to be more flexible on this topic.
Yeah, so maybe from what you're saying, moving away from a kind of one size fits all or limited way of communicating to a more flexible, broader approach. Yeah, great point. Thank you. Marcus, what's your view on this? And again, please start by giving yourself a proper introduction.
Yeah, sure. I mean, my background's coaching people to present. So I've worked a lot with people in television and a lot of politicians. And another area that I've done a lot of work is helping people with a strong technical knowledge base to communicate that to a broader audience. So my background is not in medical affairs. So very different perspective, I think, from Maja. And I think the thing that I believe has been very interesting over the last 2 years has been COVID has thrust many an epidemiologist to the front line to face the media, to talk about medical science, and really I think that's repositioned. We've gone from the research in the library to the 6 p.m. news grab, and that's just a small little microcosm of what I believe is a massively changing environment for communication. I mean, if you look at TikTok, you look at YouTube, you look at Reels, everything, Twitter, everything of these small, digestible, memorable bursts of information. And I think there has to be some way to incorporate that. We're not going to change everything, but I do think we need to adapt a little bit. And in that 20 or 30 minute window that an MSL has, there are key moments that I believe can be more effectively executed to really, I think, in the end, produce a good outcome for the patient. That's why everybody's there. I don't think that goal has changed at all.
Yeah, and I'll come back to the coaching piece because I'd love to hear more about that. But to your point, referencing TikTok, social media, which I'm a big fan of, it is challenging in the medical side because we don't want to present incomplete information. It's often quite extensive, it's referenced, and I think that makes people nervous about using those kind of bite-sized chunks. But I mean, interested in both your views. Do you think it is possible to go down that route? Are there ways to tackle that? Maja, maybe come back to you on that one.
I think it's possible. I'm just not sure if I really want that. in perspective to what you're saying. We need a bit of background on some of these aspects. I think it is possible. You can chunk it down in different pieces, but you still have to understand the whole story, the whole background, the whole environment, and that's why I'm saying strategy, right? You have to keep this in mind, even though you're just sharing a piece of it at some point. And I think that's important. It's not just bringing out little pieces of information and they're just being out there loosely, no connection to any other information. I don't think that will work very well in science. And 20 to 30 minute communication or meeting is still way longer than a TikTok. At least that's what I learned from my daughters. So there's a difference, right? We have a bit more opportunity to speak and discuss.
Yeah. Well, I've got to say, I'm not on TikTok, not yet anyway. Maybe it's something I'll try at some point. And, Marcus, when you speak to the MSLs and you coach the MSLs, are they on board with this kind of more bite-sized chunks? Can they see a way to make that happen?
Look, I think it's just another arrow in the quiver, if you will. I believe that, medical science is still the common denominator. It's still the obviously by far the most significant thing, and we want MSLs to communicate that faithfully and accurately. But naturally, if they can also communicate it in a way that incorporates some storytelling techniques, the interaction involves some skills around questioning and I think most importantly stakeholder management. I've used that expression because I know if I say objection handling, everybody will fire a red flag and say these people aren't salespeople. But I do think a lot of those dynamics of an interaction are around persuasive communication. We can get into a semantic discussion, or we can, let's be frank, MSLs are never going to sell. They don't have that style of personality. But if they think that the science purely on its own will be adequate, then I don't think that they will get to the level of performance that will make their messaging memorable.
Yeah. It's trying to maintain the attention of somebody else, impart some information, I guess tell stories to a certain degree. Same old principles.
Great.
Now, I know we've started this discussion by kind of diving into the tactical of how we're communicating, but I want to just bring this back up a level to kind of, the overall purpose of medical affairs and what we're trying to achieve. And I guess maybe a reflection from myself just to set the scene for this. The last couple of years, as we all know, COVID has been, everywhere in our lives. It's limited contact. It seems to me there's been some challenges more on the commercial side of companies engaging than there has been on the medical side. There's been more continued interest to engage on the medical side. And maybe that shifts that dynamic a little bit. So I'm interested in views from both of you, kind of on medical affairs, medical affairs role within the company and the goals of communication in that medical affairs contact. So Maja, let me come back to you on that. And it's a very big question.
So has it changed? I mean, I think it has broadened the medical role a little bit in terms of commercial colleagues not getting access, and here and there you might have to take on something that someone else would otherwise be taking on. But apart from this, I haven't seen it. Let's put it this way. I haven't seen much of a change in terms of what we're discussing. Excuse me. However, I've seen the change in how we're communicating, obviously. And the time that we have as a physician, where in the past we were sitting in an office, maybe even having coffee, there was really more room for certain aspects to discuss or to talk about. And now in the virtual environment or virtual settings, this is distilled down more to the point you actually want to discuss, to the point you actually want to communicate. So there is a change in the way we're communicating, focusing our information more like this. But the content hasn't changed that much, I would say, from what I've seen.
Okay. Marcus, what do you feel about that? What's your thoughts?
I guess, again, it's an outsider's view, but I do, because of that reason, have a lot of meetings with both medical and commercial leaders and hear a lot of their views, as well as attending a lot of conferences and so forth. My general feeling is that post-COVID, the, generic sales rep or a lot of them are called CAMs now. There will be heads cut. We're already seeing that. And in the place of that, I believe we're seeing a very buoyant medical affairs space across every company that I've engaged with. All of them are employing more people. All of them are trying to work out, for years we've had very structured processes around developing people on the commercial side of the business. Now we've got all these people who are uber qualified and what are we going to do to create because obviously that militaristic process driven sales model is just not going to cut it. You've got to create something that's much more nuanced and much more coaching oriented, exchange oriented, best practice oriented. And I think if companies can get that right, then I think that will become a real plus for certain companies if they develop that coaching culture for MSLs to stay there for longer.
Yeah, no, that's a great point. And I think, the question I just asked, if you look at kind of strategy documents within companies and you talk about what's the medical affairs objectives, you very often will see talk about disease awareness or communicating new data and all those kind of things, which are really, really critical. But let's be honest, part of this is also about building relationships with healthcare professionals, isn't it? And I think the last 2 years has really thrown that up into a very different place. So has it changed the way we build relationships? Do you see that changing sort of moving forwards? Marcus, maybe you want to comment on that?
I think Maja's probably better placed to comment on that
because you're nodding your head.
I'd be only offering sort of off the top of the head anecdotal responses to that. Maja, what do you think?
I was looking at you and I almost forgot the question. So
how we build relationships, and the key part of it is that connectivity, isn't it? And that's really hard when you can't see people. I know some of that's coming back, but I wonder if it's kind of shifted the way we approach that.
Yes, it definitely has shifted the way we approach physicians, but also the way that we have in medical have to prove our value. So as I said, you should not just walk into office and can have a nice coffee and they have a break. No, you really going to come in a situation where you have whatever time, and it's more than a salesperson, yes, but it's still a given time, and you have to prove your value. And otherwise you're not coming back. If you're sending an invite for a virtual meeting, this can be way more easier declined than you sitting in the hallway of a clinic, in the corridor of a clinic, right? Or having a good relationship with the assistants or whatever it is. So we have to be actually more, and I like the word nuanced and down to the point and specific on what we would like to communicate and also to learn. So this idea of I'm going somewhere, I'm just downloading information, not going to work. The physicians have become very much aware of the time they are spending with pharma, become very much aware of how they can create their space. I mean, many of them work way differently than before, and some of them have been very clear they're not accepting what Pharma was, as they felt, trying to push upon them. So we have to prove way more value than we had to do in the past. And we have to do different approaches, but different ways of communicating, and people are struggling to get there. So coming back to the aspect of coaching, personally, I feel we need to have a clear idea of what we want to achieve and a clear strategy, and only then you can apply coaching. Otherwise, you don't know where you're going, right? But that's where Marcus is the expert.
Well, you've opened the door nicely there for Marcus to build on that and talk about coaching and how it's perhaps changing in the world of medical communication here.
Yeah, no, look, I think it's just a very interesting space because in my view, I believe it's happening right now. It's evolving, and I think if I was to make a massive generalization, which generally makes these things more interesting, I think I think that I see a lot of different structures. I see medical managers, and then I see sort of skills people, and I still haven't really seen a model that has kind of been as structured and long running as we see on the commercial side, that people just accept and it functions well. So I suppose that's probably the thing to work out. But what I see as most important is to deliver and to make the decision to go on a journey of coaching and seeing that of value. And there are so many skills that I believe MSLs can learn and can improve on. You know, your top 10% of MSLs will be naturally dynamic communicators. But there's more than just being a dynamic communicator. As Maja said before, the strategy around an ongoing conversation. If I'm meeting a KOL 6 times, over a 3-year period, then there must be a progression from a strategic perspective in regard to the dialogue that we're having. That again, as Maja mentioned, adds value. And I think, that has to be done in a way that, finds the right motivational forces, because, we all know that I think it's been for too long this idea that, medical science is over here and they kind of do this thing that they do, we roll them out occasionally, that's not, now I see companies want them as the ambassador for that organization. Very much, the brand of the organisation, the expert, and I think that's what the KOLs want too. They want an expeditious exchange of information, and they want the most accurate, useful, pointed information that they can possibly get their hands on.
Yeah. Again, Maja, I see you nodding your head. Do you kind of agree with that perspective? Anything you wanted to add?
Yes, and I think they want this specific expertise, and there are many ways of providing pieces of information and expertise. What only a person can provide, though, and being the medical face of the company or even the face of the company, is really having the exchange. So not only the download of information or providing information on whatever channel, and I love all the channels that we have available because I think it's helpful, right, to keep attention. This is like normal life. I cannot focus on my screen all day. But really providing this valuable information they can trust, and a person who can actually communicate and ask questions to, and you're going to receive information that is on exactly the scientific level or in-depth level that you expect and that you see as a physician that you expect from yourself, right? This is something that will stay and continue. And they're coming back to this nuance. We need to be more flexible. We cannot just go in with one approach. We really need to be more flexible and adapt to the physician's needs. As I said, they're going to choose whom they spend their time with way more than in the past.
And to Marcus's point about the MSLs being almost the ambassadors for the company, I mean, I like the way he describes that, because they often can be the first entry point. As you've outlined, Maja, they're kind of sharing information. They're a good source of information. But increasingly, when I talk to companies, they're trying to kind of close this, for want of a better word, customer journey between medical and commercial, which has all kinds of nuances to it, not least using the word customer. But we are trying to sort of connect the dots compliantly there. And I see a wide range of views from MSLs as to how comfortable they are with that. Is that something that you've seen?
Yeah, I mean, it's a really interesting point, isn't it? And it's having coached people for many years, I see a range of responses to coaching input, and often people don't like coaching. They just kind of think I've kind of got this covered, especially an experienced person. Receiving feedback from somebody who may be more junior. There's this kind of idea that, I don't really need this. And I think, that cultural aspect of, how an organization works together, opening the lines of communication, because, everyone's busy, everyone's got stuff on. And so I think the idea that just introducing a range of initiatives, if they're not properly positioned in a really comprehensive manner, then there's going to be pushback, and there's going to be a lack of engagement. And I think the organisations that will really thrive in this space are those that really carefully build out a program of work that is appropriately pitched. And I think this is one thing that I'm noticing with MSLs is there's more external input around, really top level expertise around coaching. That's not to say that, the commercial side, having sales managers and sustaining all of that, they still get, coaches in for kickoff meetings, etc. But I think probably in the medical affairs space, it requires a really, really scalpel-like kind of approach to focusing on what they believe are the specific skills. And really, I also think sharing, that the ability for MSLs to share with one another best practice is absolutely vital, because, if they're having these super high level conversations and they know that certain people do certain things really well, like ask questions or, handle a really curly question, then being able to swap that information with each other quickly is, a massive plus.
Yeah, well, let me ask you that point about information exchange, Maja, because as we know, the kind of MSLs don't typically operate in the same numbers in many companies as the commercial reps. There's perhaps more limited opportunity for that interaction, but they can learn from each other. Is that something that you've seen a desire for? Are there mechanisms that you've seen employed to let them share that kind of learning?
No, there's no desire at all. And so this is a mismatch. Okay, now here we have a mismatch, because on the sales side, people have been really trained, and some of them are super skilled. And on the medical side, there are two capabilities that are required. One is the scientific acumen, and the other one is the ability to communicate complex information in an easy to digest manner, right? And this is both important. However, as Marcus pointed out, people find their way. They find their matching physicians, they get along, they learn, yes, but they're not very much used to actually reflect and learn way less. But there's also no support. I mean, I'm looking at the salespeople, there are trainers in the countries, and there are mentors and coaches and what have you. And in medical, there's no one really. And then you're surprised if you're starting this and you're just now implementing a coaching platform, and people are really pushing back because they're not used to it. They haven't got used to this idea of you can always improve, just be better than yesterday. It's not better as a colleague, it's be about yourself, and people haven't gotten to this point unless they are now struggling. Those people that are currently struggling with the situation, they are more open. But what I have not seen is really the exchange. It's actually less exchange from what I see. And this is due to the fact that, at least that's definitely true for our company, is that in the past, we've sometimes worked together with the commercial trainers to advance communication skills. The wording our commercial trainers use, though, and they get not over this, is really not appropriate for the field medicals or the MSLs. So this is where we cannot really work together until we really understand each other's role, understand how we complement each other instead of fighting for best access to a physician or whatever. So this understanding I see is still not there for everyone. And it might become easier to learn from each other. Once we have this understanding, we appreciate each other in our different roles and work closer together.
Yeah, which is interesting, because I hear a number of people say that the importance of medical engagement versus commercial is increasing. I mean, that's a whole hot topic that is a whole separate debate. But if that is the case, it's interesting to hear you say that it doesn't seem that networking and support is there in the same way. Marcus, I wonder how much of this is down to kind of how we measure success of individual MSLs, because if you talk on the commercial side, you've got very clear quantitative metrics around product sales and market share, and of course you can't talk about any of that on the medical side. It's softer qualitative metrics. How's that assessment or KPIs metrics changing?
Yeah, it's a great question, and I think it's changed, seismically in 4 to 5 years. You've gone from various technology offerings, which would be a kind of a nice to have, based on the input of the data, quantitative and qualitative metrics and benchmarking. It's just a must-have, and to me, it's the ability to identify what you believe are the key goals that you need to address as MSLs, and also to create an environment of transparency, accountability, transparency, not performance management, because that just gets people's backs up. I think it has to be a very open. This is what, over the next 3 years, this is our plan for coaching. This is how we're going to take you on a journey and really get buy-in. And then, of course, MSLs are academic snobs. These people have got PhDs from respected tertiary institutions, and they need a fairly significant level of expertise in terms of input. But equally, I think culturally, they also need to go, this organisation's paying me very handsomely, and I really need to lock into, being part of the team here. And I think that's another aspect of the change management process that definitely needs to be explored and followed up in a sustained fashion.
Yeah, thank you. Maja, I'll come to you on this, and I'm interested in your views both in terms of, more broadly with medical communication, how you're measuring success, but also at the MSL level, how you understand the individuals and how they're performing.
Yes, and I think KPIs and metrics have been way more challenging in medical than they are in commercial, obviously. And I find we should tie them more to goals. We really should define what we want to achieve. I'm finding this is not really laid down in many companies, even though we have a medical plan or a combined product plan, whatever you want to have it, right? But the medical part only goes to medic as a group, but doesn't lay it out for the MSL specifically. I think this is missing. Instead of measuring how often I'm seeing someone, it's actually what do I want to achieve and measure exactly this as much as I can. And it doesn't matter if I need 1 meeting or if I need 5 meetings to get there. That doesn't matter. It's just achieving the goal. And I'm happy with collecting numbers in terms of collecting metrics to inform my next steps and my strategy, my decisions. I'm struggling a bit when we're just looking at what we use from sales at number of contacts or time I'm spending in a physician's office, whatever have you, right?
Yeah.
And this is something that I'm missing. But we're also not having or struggling with the metrics. Might be one of the reasons why often commercial and medical teams don't work so closely together, because they don't understand each other, and they're always thinking the other group has a better whatever it is, a better bonus, a better salary, a better. I've seen companies with nice structures and clearly laid out roles, and it still didn't work at the way that I would envision it.
Yeah.
So transparency is good. And I think we need to work as a team. So maybe, even though my experience hasn't been like that, maybe in other teams, they actually grow closer together in the attempt to actually instill contact with the physicians in these challenging times.
Yeah. Yeah, and you could argue to your point about, number of meetings and calls. Does that really work on the commercial side? Everyone's trying to move more towards relationships and customer experience, which gets a lot harder to measure. Let's face reality. So I know we're into the last couple of minutes here, and at some point Dario is going to reappear and start making cut signs at me. But maybe just to finish with, as we look forward, each of you put yourselves in the shoes of an MSL today. I'd love to get your thoughts on, over the next couple of years, what are the key skills that you think MSLs should be focusing on to be successful? Marcus?
Yeah, it's a great question and a nice way to finish up. I believe it's the dynamics of communication and, the ability to take a complex message and deliver it in a way that's memorable. That, everything around that is kind of key. I think where we see things falling over is when metrics are delivered, which are so layered and nuanced and complex that they cease to really be relevant at all. Yeah. I think there's nothing wrong with, we're just going to focus on these 2 or 3 things this year. And, that's enough for a musician or a, golfer or whatever, then it's enough for anybody else. Let's just really get these 2 or 3 skills. And I think that's kind of the key, because we're seeing this thing where we, let's just throw an encyclopedia at it. And in the end, everybody just kind of, doesn't really take it seriously enough, because it's not focused and sustained enough on skills.
Yeah, keep it simple. Maja, I'll give you the last word on this. What's your kind of recipe for success?
Well, the one thing you need to have or be in order to survive the next years is you need to be flexible. You're not going to be the only communication channel. There will be other channels. They're not a substitute for you. Actually, you have to get used to the fact that you have to be on top of all those communication channels. And without flexibility, this is very hard to achieve.
Yeah. Keep up to date with this changing environment. Change what you're doing, but don't overcomplicate it, I think is what we're saying. It'll be interesting to see where this space goes. Look, thank you both. It's been a fantastic discussion. I would have loved to have done this in person. I think I said this last time I did one of these, and here we are still in this kind of window on the computer. But next time,
Dubrovnik, let's
exactly. I hope we're all going to be there. But thank you very much, both of you. This has been absolutely fantastic. I'm going to hand back over to Dario for the next session. Thanks very much.
Thank you.
Thanks, Pharma.